My name is Andy Jones. I'm a faculty member in the School of Public Health and Nutritional Sciences. My work focuses on the intersection between food systems and healthy diets. I've done work looking at how agricultural biodiversity shapes diets across in low-income countries, and also increasingly looking at how communities in Michigan what they can do through the food system to have an impact on the sustainability of diets. I'm really happy to be able to introduce Dr. Cindy Leung, who's a colleague of mine in the same department in public health. Cindy's a nutritional epidemiologist whose research focuses on diet and health disparities in vulnerable communities and populations. She does a number of different things within that broad area. She looks at how stress can underlie food insecurity and child risk of obesity. She evaluates the impact of participating in federal food programs on dietary behaviors and chronic disease risk. She's doing some work here on University of Michigan campus, understanding how food insecurity affects students here at U of M. She works with Michigan Dining, looking at interventions in the dining halls, and she's doing work learning more about the beverage contracts held by various university organizations. So she's doing a lot of great work in our community and around the country. It's advanced. Her talk title is Warning, Soda is the New Tobacco. Oh, sorry, it's not advanced. And her favorite food, which was a tough thing for her to parse out, her favorite fruit, I should say, is persimmons. And I also got information on what her least favorite vegetable was, which is beets. So let's welcome Cindy.
Hi everyone. Can you hear me okay? Okay. I'm really excited to be here, and I'm one of the co-leads for food literacy for all in the winter, and I hope to see many of your faces there because we have a great agenda planned. So in the next 5 minutes, I'm going to talk about why soda is the new tobacco, and I'm going to end with a little story about how one of our studies got bashed by Anderson Cooper on his ridiculous. As you can see, he doesn't look very happy about the results that we found. So when I talk about soda, I'm actually referring to sugar-sweetened beverages. And so this is any beverage with added sugar. This means carbonated soft drinks, pop. It also includes things like lemonade and fruit drinks, but not fruit juice. Includes sports drinks, energy drinks, sweetened teas like chai tea, Arizona iced tea, boba milk tea, and sweetened coffee drinks like frappuccinos. I don't know what this pink monstrosity is called, but also seasonal favorites like peppermint mochas and pumpkin spice lattes. So all those fit under the category of sugar-sweetened beverages. And so reason number one why soda is the new tobacco is that soda and tobacco are both really bad for our health. Here are some of the negative health outcomes from tobacco. And here are some of the ones from soda consumption or sugar-sweetened beverage consumption. And as you can see, there are some similarities. And I'll also point out that coronary heart disease and diabetes are among the leading causes of death in the US. And an unhealthy lifestyle, which includes smoking, drinking soda, and other unhealthy dietary choices, physical inactivity, all of these things contribute to higher risks of heart disease and diabetes. Reason number two is that the strategies used by tobacco companies to sell their products are being used by soda companies. So here we have a picture of the Coke Bears versus Joe Camel. Marketing to children is really big. Marketing to low-income neighborhoods and communities of color and low and middle-income countries is also a strategy that both companies have adopted. Undermining or attacking scientific research that shows their products are harmful, or funding their own research to show that their products are not harmful. These are both strategies that have been used by these industries. And 9 times out of 10, if a study is funded by the American Beverage Association or Coca-Cola or Pepsi, you can be pretty sure that they're going to say sugar-sweetened beverages are not bad for your health. So reason number 3, public health has now started to take those same approaches that we use to fight smoking in fighting sugar-sweetened beverage consumption. So this means we have started large-scale education campaigns about why soda is bad for us. We have implemented policies at various organizations. So we have no smoking policies, but some organizations like our hospital has a no sugar sweetened beverage policy. In the hospital, you cannot buy a sugar sweetened beverage in any of the cafeterias or vending machines or patient menus. Warning labels are a new thing as well. So warning labels are on cigarette packages. On the right, this is a study that I did with Dr. Julia Wolfson in one of our Michigan dining halls. We put these little bumper sticker-sized labels on the fountain beverage dispensers, and we found that these actually led to college students drinking less sugary drinks. And finally, taxes. So taxes have been sweeping the nation since Berkeley passed its soda tax. And since Berkeley has passed theirs, San Francisco, Oakland, California, Philadelphia, Cook County, Seattle, Portland, the list is getting bigger and bigger. All of these cities, municipalities are passing soda taxes now, despite the soda companies pouring millions of dollars into every city trying to fight it. So the last reason that I'm going to end with is one of the mechanisms by which both soda and smoking are bad for our health. And I'm going to skip some of these bullets, but one of those is increased cellular aging. And what I mean by this are telomeres. So telomeres are the caps at the ends of your chromosomes. They're a marker of your cell's age. And people kind of liken these to the caps on your shoelaces. The caps protect your shoelaces from fraying. Telomeres have the same function. They protect your chromosomes, your DNA. And we know that lifestyle factors like stress, poor diet, physical activity, smoking, obesity, all of these things shorten our telomeres in addition to just how old we are. And so we did a study a couple years ago where we took data from 5,000 healthy adults from the Health and Nutrition Examination Surveys and Haynes, and we found that people who drank 20 ounces of soda, regular sugar-sweetened soda, every day had about telomeres that were 4.4 years older than people who didn't drink soda. And we compared this magnitude to another study among smokers, and they found that heavy smokers had telomeres that were 4.6 additional years older. So apparently this caught the attention of Anderson Cooper's producers. He found the idea that somehow drinking soda was as bad for you as smoking to be very jarring. And he compared this to saying eating a Big Mac was as bad as shooting heroin, or eating popcorn and candy at the movies was the same as taking a handful of OxyContin. We didn't look at those things in our study. But what I want you to take away is that, in the nutrition world, most of us would think that in the supermarket, one of the worst things that you could buy are sugar-sweetened beverages. They have almost no nutritional value. They are so aggressively marketed to all of us. They are so prevalent everywhere. Even in the School of Public Health, you can buy soda. And the strategies that we have used now to try to reduce soda consumption, we are taking from the tobacco playbook. So I hope the next time that you hear of a public health strategy to reduce soda consumption, you don't think of it as taking away your choice to pick your beverage, but you think of it as not so far-fetched of an idea to improve nutrition at the public health level. Thank you very much.